Hello, class. This is Tutor Godwin. We will be talking about pulmonary circulation. Pulmonary circulation consists of the circulation of blood from the right ventricle of the heart to the lungs and back to the left atrium. The pulmonary arteries. There are two branches for the pulmonary trunk. 1. Right pulmonary artery. It passes to the root of the right lungs and divides into the branches. Larger branches carry blood into the middle and lower lobes. Smaller branches carry into the upper lobe. 2. The left pulmonary artery runs to the left lung, where it divides into two branches. One passes into each lobe. Within the lungs, these arteries divide and subdivide into smaller arteries, arterioles, and capillaries. The interchange of oxygen and carbon dioxide takes place between capillary blood and air in the alveoli of the lungs. After gas exchanges, each capillary will join together and form vessels. Ras capillaries, gas venules, was veins. There are two pulmonary veins, the right and left pulmonary veins. Both will carry oxygenated blood into the left atrium of the heart. 2. Systemic or general circulation. It is the circulation of blood all around the body. The blood pumped out from the left ventricle is carried by the branches of the aorta around the body and is returned to the right atrium of the heart by the superior and anterior vena cava is known as systemic circulation. Blood vessels. Blood vessels act as pumps to supply blood throughout the body. Blood vessels vary in structure, size, and function, and there are several types. 1. Arteries. 2. Arterioles. 3. Capillaries. 4. Venules. 5. Veins. At any given moment, about 30% of the blood in your systemic circulation will be found in the arteries, 5% in the capillaries, and 65% in the veins. Arteries and arterioles. These are the blood vessels that transport blood away from the heart. They vary considerably in size, and their wall consists of layers of tissue. Tunica adventitia. The outer layer, fibrous tissue, tunica media. The middle layer, smooth muscle and elastic tissue. Tunica intima. The inner layer, squamous epithelial tissue, anastomosis, and end arterioles. Anastomoses are arteries that form a link between main arteries supplying an area. End arteries are the arteries with no anastomoses, or those beyond the most distal anastomosis. Capillaries and sinusoids. The smallest arterioles break into several microvessels called capillaries. The walls consist of a single layer of endothelial cells sitting on a very thin basement membrane, through which water and other small molecules can pass. Entry to the capillary bed is controlled by rings of smooth muscle, precapillary sphincters, that direct the blood vessels. In certain places, including liver and bone marrow, the capillaries are significantly wider and thicker than normal. These are known as sinusoids. Veins and venules. Veins are blood vessels that return blood at low pressure to the heart. The walls of the veins are thinner than those of arteries, but have the same 3 layers of tissue. Veins have valves, which prevent backflow of blood. These are formed by folds of tunica intima and strengthened by connective tissue. The smallest veins are called venules. Blood supply. The outer layer of tissue of thick-walled blood vessels receives their blood-walled blood supply via a network of blood vessels called the vasa vasorum, a thin-walled vessels, and the endothelium passing through them receives oxygen and nutrients by diffusion from the blood of others. Nerve supply. Vasomotor center in medulla. Oblongata, autonomic, beats sympathetic stimulation. Contraction of smooth tunica media. Your vasoconstriction, nerve system, parasympathetic stimulation. Relaxation of smooth muscle. Muscle of the tunica media. Vasodilatation. Lumen of the blood vessel decreased. The lumen of a blood vessel increases aorta. The aorta is biggest artery in the human body and begins at the upper part of the left ventricle and passing upwards for short way. It arches backwards and to the left. It then descends behind the heart through the thoracic cavity a little to the left of the thoracic vertebrae. At the level of the 12th thoracic vertebra, it passes behind the diaphragm, then downwards in the abdominal cavity to the level of the 4th lumbar vertebra, where it divides into the right and left common iliac arteries. The aorta will be described here according to its location. 1. Thoracic aorta. This is the part of the aorta that lies above the diaphragm and is described in 3 parts. Ascending aorta, arch of the aorta, descending aorta in the thorax, E.A. Ascending aorta. It is about 5 cm long, lies behind the sternum. 2 blood vessels starting from the ascending aorta are right and left coronary arteries. B. Arch of aorta. The arch of the aorta is the continuation of the ascending aorta. It begins behind the manubrium of the sternum and runs upward, backward, and to the left, in front of the trachea, and it is continuous with the descending aorta. Brachiocephalic artery. Left common carotid artery. Left subclavian artery. Venous return from the head and neck. The venous blood from the head and neck is returned by deep and superficial veins. The superficial veins will drain blood from the superficial area of the brain, and deep veins will drain blood from the deep area of the brain. Veins of the head and neck. Number 1, right and left middle temporal vein. Number 2, right and left supraorbital veins. Number 3, right and left. Maxillary vein. 4, right and left facial vein. 5 point right and left lingual vein. Bar 6, right and left occipital veins. Veins of the head and neck. Ophthalmic vein, superficial, temporal vein. Facial vein, occipital vein, posterior auricular vein, external jugular vein, vertebral vein, internal jugular vein, superior and middle thyroid veins, brachiocephalic vein, subclavian vein, superior vena cava. Now that we have explored the blood vessels and circulatory pathways, it's crucial to understand how these components work together to ensure the proper functioning of the body. The harmonious interaction between arteries, veins, and the nervous system guarantees that each organ receives the right amount of blood supply, maintaining our body's equilibrium. Tutor Godwin, can you explain how lifestyle affects our circulatory health? Certainly. Lifestyle choices like diet, exercise, and stress levels significantly impact circulatory health. For instance, regular exercise strengthens the heart muscles, while a balanced diet can improve blood vessel elasticity. Thank you all for your attention. Remember, a healthy lifestyle is crucial in maintaining an efficient circulatory system. Stay active, eat well, and take care of your heart.